appendicular skeleton. For the exam, I want you to study this picture, okay? This is a very nice visual of all the bones that are in the axial skeleton and all the bones that are in the appendicular. Let's look at the appendicular first. The appendicular is basically your upper and lower limbs and your hip and your pelvis, pelvic nerves. Okay. And your axial skeleton is going to be your head, face, torso, and that's in purple. So, if I ask you in the exam, where's the clavicle? Is it in the axial or the appendicular? Appendicular, why? You got it, because it's attached to the arm, to the shoulder. Very good. What about the sacrum? Is that in the axial or the appendicular?
Axial.
Axial. Good, good. Please know these. You want to study, you want to know all the bones that are in the axial and all the bones that are in the appendicular. So let's talk about the skull. Do you remember when we dissected the brain? And I showed you on the brain that we had the frontal lobe and the parietal lobe and the temporal lobe and the occipital lobe. Well, the skull is basically the same, but instead of saying lobe, we say bone. So this would be the frontal bone, including the forehead. Okay, so this is the frontal bone. This would be the parietal on both sides. This, way down here, would be the temporal. Okay, so this would be the temporal bone. And then in the back would be your occipital. Okay, does that make sense? Okay. And I'll show you a picture in a minute. So, frontal bone, parietal, temporal, and occipital in the back. So the frontal bone contains the frontal sinuses. It forms the upper portion of the orbits of the eye, forms the coronal suture with the two parietal bones. So the good news is we only have sutures in the skull. We don't have them anywhere else in the body. And this is going to be your coronal suture, right here, coronal suture. And you can look at it and see that it separates the frontal bone from the parietal. If there's an extra suture, nothing. I mean, it wouldn't cause any issues. I've never seen it. But that doesn't mean. And why do we even have, or why do we have the sutures? Yeah, because when a baby's born, their skull looks different, right? What's different about a baby's skull? Yeah, it's not fused. And why is it open like that? Why, it's called fontanelles, but why do we have those soft spots?
So that they could go through the brain.
To give the brain room to grow. So, very good. So I want you to know that the skull is made up of 28 bones in two major divisions, the cranial bones and the facial bones. And again, the frontal bone forms the forehead and the anterior top of the cranium. Here's a really nice picture of the frontal bone. Nice view. For your pictures, some will be in color and some will be like this. Let's one bone. It's not, it's actually two separate bones. Okay, it's called the maxillae, so I want you to know that, the maxillae. And it's two bones. And here is the largest bone of the face. It's called the mandible, it's our jawbone. Largest bone of the face. If you notice, it's the only bone that doesn't articulate with the maxilla. It doesn't touch the maxilla at all. And then throughout the skull and throughout the face, we have holes. But we don't refer to them as holes, we call them foramen. So we have a big hole right here. What do you think this is called?
Foramen magnum.
The foramen magnum. And what goes in that foramen magnum? Somebody took, I think I took my skeleton, yes, the spinal column, the spinal cord. Excellent. And then this little guy here, there's two little holes here in the mandible. And they're called mental foramen. Mental foramen. Why do you think they're called mental foramen? Mental. No, no, actually it's because when we're deep in thought, we tend to do this, like we're thinking. And that's how they came up with mental foramen. What do you think comes out of these foramen? Mental nerves and vessels. That's what comes out of the foramen. And out of most of the foramen that we're going to talk about. It's all nerves and vessels. Now this is a great side view. So here we have our frontal bone. Here we have the coronal suture. Here we have the parietal bone with this tan color. And then the darker brown is going to be the occipital bone. And all of this in pink is the temporal bone. Okay, so I want you to know that. Okay, I really want you to study this. If I ask you what suture separates the frontal bone from the parietal bones, what are you going to tell me?
The coronal.
You got it, the coronal suture right here. And then this one is the squamous suture. And it's going to separate the parietal from the temporal. And then we have the occipital, the lambdoid suture, and that separates the occipital bone from the parietal. Okay, so you want to know those. I also want you to know when you hear the term zygomatic, you want to think of cheekbone. Zygomatic bone. Cheekbone. And you want to be able to identify the styloid process. The styloid process, we have one on each side. And they're located in the temporal bone. In the temporal bone. Another one that I want you to identify is the mastoid process of the temporal bone. Right here. The mastoid process. So it's right here. On both sides. Now this mastoid process or mastoid bone has a clinical significance. Do you know what it is? Anybody? So if you have a small child that has an ear infection, and if it's left untreated, it can spread to this mastoid process. If that happens, it's referred to as mastoiditis. At that point, we would probably have to go in and do a mastoidectomy and remove that mastoid bone. If the infection, if we don't do anything, that infection will go from the mastoid process to the brain, and more than likely death will occur. Okay. That's why it's so important when children have ear infections to get them treated. Okay. They can get out of hand very, very quickly. I mean, even with adults. We had an instructor here who had a severe double ear infection. And it was weird because she couldn't hear. That's how it started. She was having trouble hearing. And we looked at her ears and they looked fine. You couldn't see anything. That night, she was super sick, went in, and it was a severe infection. So it can happen really, really quick. So it's important to get it taken care of. And how do we treat it? Antibiotics. Good. Okay. If we open this up, try to. Okay. So this view is looking at it just like this. Okay, and I'm going to point out some things that I want you to be able to identify on the test. So let's start here at the very top. This is called the crista galli. The crista galli. And on each side of the crista galli is the cribriform plate. The cribriform plate. You see how it has little holes in it? That cribriform plate is where lots of olfactory vessels go through. So it actually is, one of the big functions is for our sense of smell. Or olfactory. Now I want you to know the clinical significance of the cribriform plate is that if it's cracked, it's very hard to do, but blunt trauma, accidents, things like that. If this cribriform plate is cracked, infection will set in and go immediately to the brain. So it's very lethal. I mean, it's really deadly when that happens. But I want you to associate the cribriform plate with olfactory, which is our sense of smell. And next semester, we'll talk more about it. If I wanted something. I want you to know that the crista galli and the cribriform plate actually make up the ethmoid bone. The ethmoid bone. So if I ask you on a test, what two structures make up the ethmoid bone? You're going to tell me the crista galli and the cribriform plate. Now, moving down, we have the lesser wing. The lesser wing. Right below the lesser wing, we have the greater wing. And in the middle, we have the sella turcica. The sella turcica. All three of these bones make up the sphenoid bone. The sphenoid bone. So the lesser wing, the greater wing, and the sella turcica. Okay, remember lesser's on top, greater wing, and in the middle is the sella turcica. All three make up the sphenoid bone. And here is your big foramen magnum. both sides, we have the jugular foramen. The jugular foramen. What do you think comes out of the jugular foramen? Yeah, the jugular. So jugular foramen, nerves, muscles. So for the exam, being able to identify cristagalli, cribriform plates, lesser wing, greater wing, semiturgica. Foramen magnum. The jugular foramen could be a possible identification item. Slide 8, this is a little different view. Here's your styloid processes. We're going to talk about those in a minute. We have 2 other styloid processes, and they're in the UR. Again, we'll talk about those in a second. Here are your occipital condyles. Occipital condyles on each side of the foramen magnum. So be able to identify these occipital condyle. You okay so far? So, parietal bones. You want to know they form the bulging top of the cranium. And you've already seen these right here. The parietal bones. They form several sutures. The temporal bone contains the mastoid sinus. Right? That's where the mastoid process is in the temporal bone. I promise I'm going to answer that in the test. So if I ask you in the test, where are the mastoid sinuses located, what are you going to tell me? The temporal bone. What if I ask you where the mastoid process is located? It's the temporal bone, right? The temporal. Everybody's going to get that right, right? Okay. The lambdoid suture is formed by the parietal bones and the occipital bone. And we've already seen that. That's the suture in the very back of the skull. Lambdoid. You should to identify that. Lambdoid suture. Then the other thing I have here to bring to your attention, we already know about the coronal suture. It's formed with the frontal bone. But you want to know temporal bones house the middle and inner ear structures. And that's where that mastoid process comes in with ear infections. And let's talk about paranasal sinuses. Paranasal sinuses. We'll start with the frontal sinuses. So they're going to be right here at the top of the nose and into the forehead. And then we have the sphenoid sinuses, which are on the side of the head in that temporal area. And then we have the maxillary sinuses. And as you can see, they're right here. They're even going to affect the maxillary area. And you see the lacrimal sac there. So what does lacrimal, when I say lacrimal, what do you think of? Tears. If you've ever had a sinus infection, well, sometimes it's just one that's infected. Sometimes it's 2, sometimes it's all 3. So you've got the frontal that's infected, you've got the maxillary, and you've got the sphenoid. It's going to cause the eyes to water, right? We can have some drainage from those. And basically, the patient is very, very uncomfortable, right? And I think we've all had a sinus infection at one point, I would assume. How do we treat these sinus infections? Antibiotics. In New Mexico, we have a lot of sinus infections. Why? Yeah, and it's so dry here, right? So lots of sinus infections. Something they're doing now, which I don't agree with, but they don't ask me, with the elderly, because sometimes the elderly have chronic sinus infections. They put them on antibiotics basically for the rest of their lives, right? So if they're in their 70s or early 80s, and they have these chronic sinus infections, they just say, here, take these antibiotics, you'll be fine. What is wrong with that? They go resistant. What happens if they get sick? Right? What else do antibiotics do that's not good? It takes away our good flora, right? And if we're going to be on antibiotics long term, what should we be doing? Replenishing with probiotics, yogurt, things like that. It will really destroy the stomach. I've had so many patients over the years that's been on antibiotics for acne and long term, and now everything they eat makes them sick because no one told them that they should be doing probiotics. We can't assume that they know. We have to educate, make sure they know. Occipital bone forms the lower posterior part of the skull, forms a movable joint with 3 other cranial bones, and a movable joint with the first cervical vertebrae. Does anyone know what the first cervical vertebrae is called?
The axis.
Did you say axis or atlas? It's atlas. Yeah, atlas is the first, but the second one is the axis. Yeah, good. And I'll show you a picture. The sphenoid bone is a bat-shaped bone located in the central portion of the cranial floor. That's all I have here. The ethmoid bone forms the anterior cranial floor, medial orbit walls, upper parts of the nasal septum, and side walls of the nasal cavity. And you already know now that the herbiform plate is located in the ethmoid bone. And what's its function? Herbiform plate? For smell, right? Olfactory smell. The upper jaw, the maxilla, I want you to know we have 2, right? I've already said that. It's not 1 bone, it's 2. And I want you to know that they form the keystone of the face. They form the keystone of the face. I want you to know that each carry a maxillary sinus. And by the way, the maxillary sinuses are the largest of the paranasal sinuses. You want to know that. The maxillary sinuses are the largest of the paranasal sinuses. And as far as the articulations go, if you can just remember that the mandible, the jawbone, does not articulate with the maxilla, I will be thrilled. The mandible does not articulate with the maxilla. I don't expect you to memorize all these articulations. And I have it here. The mandible is the only facial facial bone that does not articulate with the breast. The mandible, the lower jaw, forms the only movable joint of the skull with the temporal bone. The zygomatic bone shapes the cheek and forms the outer margin of the orbit. It forms the zygomatic arch with the zygomatic process of the temporal bones. Just remember, zygomatic is cheekbone. Zygomatic, cheekbone. You want to know that the mandible is the largest, strongest bone of the face. And this, I'm not going to ask you, but I wanted to bring it to your attention in case they mention it in court. Another name for the zygomatic bone is the malar bone. Okay. Like I said, I won't ask you that, but it may come up and I want you to know what it is. Okay, that's all I have there. Nasal bones, these two bones form the upper part of the bridge of the nose. Cartilage forms the lower part. Lacrimal bones, they're pinker thin bones that lie just posterior and lateral to each nasal bone. And again, remember lacrimal tears. We can have two problems regarding the tears in the tear ducts. One, which is the most common here, is dry eye. Because it's so dry, patients tend to suffer from severe dry eye, which can cause what? If the eyes get too dry, what can happen? It causes what? Corneal abrasions. Corneal abrasions. So how do we treat dry eye? Artificial tears, tears, things like that. Now there's another problem, it's not as common, and that's where the eyes will just constantly tear. Sometimes it's from allergies, sometimes they actually have to have surgery to correct it. It could be just in one eye, or it could be in both eyes. And there's only one surgeon that I know of here that does it, but it's a fairly rare condition. Usually it's the opposite. The patients have dry eye. Any questions so far? No? I feel like it's a Monday. Is that what it is? You guys are on time, or did you work yesterday?
Of yesterday.
I'm sorry?
We beat ourselves up yesterday.
You beat yourselves up?
We had an exam for chemistry.
Oh, I didn't check the grades. Were they okay? Yeah. Then why did you beat yourself up?
Studying.
Oh,
So we got the good grades.
well, there you go. Okay, let's do chapter 7, part 2. Better. Chapter 7, part 2, you guys there? Well, maybe it was good that we rescheduled the exam for here. Did that make you happy? Yeah. For those of you that came in a little bit late, what did we decide? We're gonna have the exam on Monday, for 7 and 8. And then chapter 9, we'll have a quiz on Friday. And I will lecture on all of it today. Okay. So it's death by PowerPoint. fetal skull. So remember I said the fetal skull is different. It has something called fontanelles. You don't have to know this, but something interesting, the head at birth is a quarter of the total body height. At maturity, it is about 1/8 the total body height. So I think it's kind of fair to say that babies are all head. Paranasal sinuses change in size and placement with skeletal maturity. I want you to know that the fontanelles are the soft spots that allow the skull to mold during birth and also show rapid growth of the bone. Now, I don't have children, but I love to watch kids grow, and I like to see, like newborns, what do they mostly do? They just sleep, right? And then when they get to be about 6, 7, 8 months, and you take them places, you notice that they're starting to see things. They're starting to put things together, and like they'll look at something and they'll just laugh, and then they'll look at it again and they start crying, and then they'll, so then it's kind of neat, but you can see and like tell that brain is growing, and it's, developing. So we have inferior nasal conchae or turbinates. These turbinates are going to help warm the air when we breathe through our nose, which is very important. What else does it do when we breathe through our nose? It filters the air. So not only does it warm the air, but it filters the air. And that will help us avoid catching a cold, right? Have you ever had a cold where your nose is stuffed up and you can't breathe through your nose and you have to breathe through your mouth? Well, what happens when you have to breathe through your mouth is that you're taking in all the germs, right? So then you start to get better from the cold, and you're like, okay, yeah, I'm feeling better. But then you get sick, right? They call it rebound cold. But part of the reason why you get sick again is because you have to breathe through your mouth, and you were taking in more of the germs. Here is the fontanelles I was talking about, the soft spots. Hyoid bone, the hyoid bone. Let's see if I have a little hyoid bone. This is the hyoid bone. There's a few things I want you to know about the hyoid bone. It's the only bone that doesn't articulate with any other bone. It's all by itself. It does not articulate with any other bone. I also want you to know that it supports the tongue. So the function of the styloid bone is to support the tongue. And remember I showed you those styloid processes? Well, that's where they suspend from, the styloid processes. And this is what it looks like. So this is the hyoid bone. Just like this. I think I told you, I'm not sure, but it's of clinical significance. Why? Aside from the fact that it supports the tongue. So if there is a person that we think committed suicide by hanging, we'll do an autopsy, and if the hyoid bone is intact, then they probably did die by suicide by hanging. But if the hyoid bone is crushed, then they were probably choked to death. Because that's, one of the only ways that we could actually break that hyoid bone. It is extremely rare that this hyoid bone would be crushed by hanging. I mean, extremely rare. Okay. So that's one of the things we look at during an autopsy.
Okay.
Yeah, there you go. Okay, the vertebral column forms the flexible longitudinal axis of the skeleton. The characteristics of the vertebrae, well, you already know one thing about the vertebrae. They're the most irregular of all the bones, right? I mean, nothing's more irregular than a vertebrae. All but the sacrum and coccyx have a vertebral foramen, okay? And that vertebral foramen is going to be the holes. Okay? And they all have them except for the sacrum and the coccyx. I want you to know that the only vertebrae that has a dens is the second cervical vertebrae. The second cervical vertebrae, which is called the axis. The axis. So please know that I promise this will be on the test. Second cervical vertebrae called the axis, AXIS, is the only one that has the dens. And that dens will allow the rotation of the head. I think I have a picture here. This is the atlas, by the way. This is the cervical vertebrae 1. This is the first one. And here is your axis, and that's the dens I'm talking about. So you want to know that. I want you to know that we have 7 cervical vertebrae. They're at the very top of the vertebrae. We have 7. We have 12 thoracic vertebrae, which is in the middle of the back. And we have 5 lumbar vertebrae. 5 lumbar. We have 5 sacral bones, S1 through S5, that actually make up the sacrum. And we have 1 coccyx, that's our tailbone. So if our patient suffers spinal cord injury, the higher the injury, the worse the prognosis. And the reason being is because with spinal cord injuries, let's say the patient has a C3 injury. Well, it doesn't affect anything above. It affects below. So if it's C3, it's going to be below C3. And it could affect all the way down. Okay. So let's say the injury is T12. It's not going to affect anything up here. It's going to affect below T12. So if a patient has a cervical spinal injury C1, C2, they could be paralyzed from the neck down.
So C1 is atlas and C2 is axis?
Correct. Correct. And which one has the bones?
Axis.
The axis. Good. Yeah. So this is a perfect vertebrae. This is textbook perfect. This is what they should look like. Well, let me show you these before we get into pathologies. So this is a little cervical vertebrae. Okay. You know it's cervical for a number of reasons. The body, this is the body, it's super small compared to the lumbar. See the difference, right? And even the thoracic has quite a large lumbar compared to this. And it also kind of looks like a fish. He says he's not fun. He looks like a fish. But you can't put that on the test. And the thoracic kind of looks like a giraffe. A little bit. Do you see it, Kevin? Okay, what about this one? This definitely looks like a moose. Yeah? Okay. How many lumbar do we have? How many thoracic do we have? How many cervical? Okay, the coxal bone. Oh my goodness. Let's see. So I want you to know that hip bone, coxal bone is made up of 3 bones. I want you to know that. The ilium, which is the largest part, the ischium, and the pubis. Okay, but if you can just remember, the 3 bones make up the hip bone. Ilium, ischium, pubis. So the vertebral column as a whole articulates with the head, the ribs, iliac bones. Individual vertebrae articulate with each other in joints between their bodies and between their articular processes. So the sternum, what's another name for the sternum? Breastbone, yeah, the breastbone. So something like this. We have this is the body of the sternum. And actually, let me show you. Here's the body. This top part is called the manubrium. And the bottom is the xiphoid process. Okay, so you got your xiphoid process at the very bottom. Here's the body. Here's manubrium. This little line here, which is not labeled on this, but this little line is called the sternal angle. The sternal angle. And this little indentation here, which is also not on the picture, it's at the very top of the manubrium. This is called the jugular notch. The jugular notch. Right there. And the sternum is actually an example of what type of a flat bone. Good, yeah, flat bone. Excellent. And what's all of this here? It's in purple or blue here. It's costocartilage, yeah, costocartilage, which attaches to our ribs. And then of course we have the clavicle up here. What's clavicle? Is it appendicular or axial? Appendicular. Appendicular. Okay. Because it's part of the arm. Okay, I want you to know that for true ribs is 1 through 7. True ribs are 1 through 7. Why do we call them true ribs?
They're attached to the spine.
They're attached to the sternum, right? So 1 through 7 They're attached to the sternum. Now, there's a mistake on this picture. False ribs should really read 8 through 10. So 8, 9, and 10 are false ribs. The reason we call them false ribs is because they don't directly attach to the sternum, but they do indirectly. Okay, so we refer to them as false ribs. The floating ribs are 11 and 12, and we call them floating ribs because they don't attach to the sternum at all. Not indirectly, not at all. So they're floating. What happens if our patient breaks a rib? What can we do for him?
Actually, they're doing nothing.
Yeah, they don't do anything, right? They wait for it to heal. What if they break their sternum? Which, by the way, they're going to present with the same symptoms as a broken rib. They're gonna have, it only hurts when they breathe, right? Or when they cough or sneeze. What do they do for that? Nothing. There's nothing. They just have to wait for it to heal. Okay. So I want you to know we have 12 pairs of ribs. You want to highlight that in your notes real big. 12 pairs of ribs. With vertebral column and sternum, form the thorax. Each rib articulates with the body and transverse process of its corresponding thoracic vertebrae. And I also want you to, and we'll talk about this more moving forward, but this sternum and the ribs are going to protect the what? The heart and lungs, right? It's protection for the heart and lungs. When we talk about cardio, this is a very rare condition, but sometimes babies are born with their heart on the outside of their chest. So we'll talk about that when we get to cardio. I've already said this, ribs 1 through 7 are called true ribs. 8 through 10 attached to the costal cartilage of the rib above it, so they're referred to as false ribs, and 11 and 12 are floating. Okay, some disorders of the axial skeleton. So I said axial, so what are you thinking? Yeah, that head and the torso, face. Okay, so we talked about mastoiditis, it's an infection of that mastoid bone or mastoid process. May need a mastoidectomy. And then we'll talk about the abnormal spinal curvatures. So this is a severe condition of, it's called Scheuermann's disease, and it involves the thoracic vertebrae. Okay, so vertebrae, how many thoracic vertebrae do we have? 12. Okay. And this is referred to as kyphosis. Kyphosis. I hate to use this term, but we used to refer to it as hunchback. Okay, I want you to know it affects the thoracic vertebrae, and this is a really severe case. Okay, and it's called kyphosis. Kyphosis. So kyphosis, you want to put affects the thoracic vertebrae. And of course it causes hunchback. Now we can have another issue that affects the lumbar vertebrae, and it's called lordosis. You can remember that because lordosis starts with an L and so does lumbar. Okay, this is called lordosis. And this is another picture of kyphosis. That's the thoracic vertebrae. And then we have scoliosis, right? Scoliosis, which affects the entire vertebrae. This is the way the spine should look, and this is scoliosis. Okay. So the earlier we can detect scoliosis, the better the prognosis. They can even do some surgeries now, which they, that's relatively new. I told you when I was in not high school, I was in grade school, how they tested for scoliosis, did I tell you? We all had to go to the gym, everybody, and then they would have nurses and doctors, and they would have you bend over and they would check your spine. If you were okay, you could leave. If you had scoliosis, you had to go in the back of the gym. It was a huge HIPAA violation, right? But the only good thing about that is that we could diagnose really early. Any questions on this? No? Okay, if we have abnormal curvature of the spine affecting the thoracic vertebrae, what's it called? Kyphosis. What if it affects the lumbar? Lordosis. What if it affects all of it?